Hello, this is MLT 126, Immunology and Serology, and this is the first unit. The first unit is kind of like an overview of serology. I hope that you find a lot of this things that you already know, especially in the beginning, because you should have went over it in other classes, anatomy or maybe in high school if that's not too long ago for some of you. Um, but I don't think this class is going to be too difficult for you to grasp. So what immunology is the study of the immune system. And you know that your immune system is what fights off infections and keeps you from getting sick. So immunology is the study of how our body is able to recognize something that comes in that's not supposed to be there, and acts on it to try to get rid of it. It recognizes, responds, and interacts with foreign antigens to protect against infection and disease. Antigens or anything that comes into the body that your body doesn't know as itself. So an antigen can be a bacteria like strep, it can be a virus like mono or the flu, it can be a parasite, it can be a fungus. Anything that comes into your body that your body knows does not belong there. Um, an antigen is capable of causing an immune response. So when an antigen comes in, your body sees it and your body starts to react to it to try to get rid of it. So anything that causes an immune response is an antigen. Um, Immunity is very complex. We're not even touching even half of what goes on in immunity. There's so much we can go into, so much detail with all of the things that we're covering. It's unreal. So whenever a good amount of an antigen enters into the body, two kinds of immunity are going to occur at the same time. One is nonspecific, natural, or inborn, and one is specific, acquired, and adaptive. So these are two different kinds of immunity that start to happen whenever an antigen enters the body. The nonspecific and the natural is when the spleen and the liver try to filter the antigen if it's in the bloodstream, and they cause cells to go in and try to fight off that antigen. So there is a cellular response, meaning the cells are going to respond, and these are the the granulocytes and the monocytes. And then there's a humoral response, and the humoral response refers to chemicals. The chemicals involved there are complement, the lysozymes, and cytokines. And these are things that come in and try to break down the antigen. The granulocytes and monocytes try to eat it, and complement and lysozymes and cytokines try to lyse it and break it down and destroy it. At the same time, there's a more specific, and this is due to antibody production. And an antibody can be produced by lymphocytes, specifically the B lymphocytes. So when a flu virus comes in, the lymphocytes will start to produce an antibody towards that flu virus. So not there's two different kinds of lymphocytes, the B lymphs and the T lymphs. The B lymphs are the ones that make the antibodies. So there's a cellular response, and the cellular response is the lymphocytes. also called immunocytes. And there's a humoral response, which is like over here is the chemical response, and this is the antibody production. The antibodies will attach onto the antigen and try to inactivate it and eventually cause it to lyse. But what is so specific about antibodies is your body will make antibodies specifically to the flu virus, or specifically to the monovirus, or specifically to the strep. These just fight anything that come in. Anything, it doesn't matter what kind of virus. The B lymphs will produce specific types of antibodies towards specific types of antigens. Okay, the immune system helps to prevent organisms from coming in. If they do get in, that they try to get rid of them, and they also try to prevent tumor cells from growing. Okay, the factors affecting the natural or the inborn immunity, which are the lymphokines, cytokines, and the granulocytes and the monocytes. There are some things that can affect that. First, it's genetics. Each species recognizes different types of substances as foreign. So a type of bacteria may be normal to a cat or a dog, but it can cause a person an infection. Age, the more young and the more older people are more susceptible to antigens getting inside their body. Nutrition, especially certain types of vitamins, A, C, folic acid, and the B vitamins are supposed to boost the immune system and make you capable of getting rid of antigens that are going to make you sick. Basic amino acids have to be in the diet. The amino acids are the backbone of what makes up the antibodies. So what you eat helps to make your immune system stronger or not. Exercise strengthens the immune system. Enough rest strengthens the immune system. Stress, too little or too much. So you can have too little and it make your immune system weak. There's a new field of medicine called psychoneuroimmunology that studies the relationship between how your brain works and your immune system, and how well your immune system fights it off depending upon your mental status. Stress can lead to the production of tumor cells and abnormal lymph tissue. That's what atrophy is, just abnormal lymph tissue or cells. And also predisposed factors like endocrine problems, like thyroid problems, mental illness, nervousness, and sleep deprivation can put you more at risk for letting an antigen in and you getting sick. Okay, the natural defenses of your body. The physical barriers are the first line of defense. The skin is the first thing. It covers your whole body. It should not be dry or broken. Dry and broken will allow organisms to come in. The acidic environment will help prevent things from getting in through your skin. Also, your mucous membranes and the cilia and the little hairs in your nose, those help keep things out. Earwax keeps you from getting infection. Normal flora of the skin helps you keep you from getting infection. The acidic pH of the stomach and other cavities and fluids in the body help to keep organisms out because the environment is too acidic for the organisms to live. Okay? The vascular response. whenever there are injured tissues, then there is a inflammatory reaction that occurs. And this is an immunology response. Whenever there's an injured tissue, there's a cut, there's a tear, the cells come in that cause heat, pain, and swelling. And that's just like inflammation, but it's an immune response to help get rid of whatever has caused the problem. The vessels near where the injured place is dilate to help get more blood there so that cells can get there to fight off whatever's wrong. And increased blood flow to an area is called hyperemia. Serum passively flows to the injured area, which would cause an exudate or edema. That means just extra fluid. Fibrinogen is a protein that helps in blood clotting. Will convert fibrin strands to create a clot, which would trap the antigen in it. Okay, these are the cells that are involved in natural immunity, and these are all types of phagocytes, and these are all types of white cells. The monos, this is a monocyte, this is a neutrophil, this is an eosinophil, and this is a basophil. These are all types of white cells, like I said. The monocyte, out of 100 cells, the monocytes are usually 4 to 12% of all the white cells in your peripheral blood, which means in your veins and arteries. They fight off bacterial infections and tissue damage. They come in and clean up when there's tissue damage. A monocyte is referred to as a monocyte, and when it travels to the tissue out of the veins or arteries, the name changes to a macrophage or a histiocyte. And this is called a foamy cell, but it's kind of what a macrophage looks like when it gets to the tissues. It kind of changes its shape, it gets larger, and it starts to eat things. The monocytes leaving the vascular system into the tissue is called diapedesis, and they come in and try to phagocytize or eat eat the antigen. They also are involved in chemotaxis. They can release a type of chemical to notify the T lymphs that an antigen is there, so the T lymphs will come in to fight the antigen, and this is called antigen presentation. The monocytes just simply say, hey, T lymphs, there's an invader over here, come and get it. So that's antigen presentation. The monocytes are stimulated to attack bacterial cells by lymphokines, so T lymphs can also notify the monocytes. They're large with a lobated nucleus. They usually have vacuoles in them and a smooth gray-blue cytoplasm. So that's what monocytes look like. This is a neutrophil. The neutrophils are 50 to 70% of all the white cells, and these make up the majority of the white cells. They fight off bacterial infections, and they're part of the granulocytes. Neutrophils, eos, and basophils are granulocytes because they have granules. So the neutrophil looks like this. It has a 3 or 4 segmented nucleus, so you'll see segments. They're larger than the red cells, you can see, and they have granules in them, and a neutrophil has kind of reddish, orange, purplish looking granules, but nothing really dark. The eosinophil is less than 3 of all the white cells. It fights off allergic, fungal, and parasites. They have large red to orange granules. This is a granulocyte also, and this is what it looks like. And sometimes these orange granules cover up the nucleus so you can't see it. But these have a segmented nucleus also. The basophil is less than 2% of all the white cells. They have large blue-black granules in the cytoplasm. Those granules have histamine in them, and histamine causes the vessels to shrink, which is vasostriction. And they also release heparin, which is a type of blood thinner. They're a part of the granulocytic series, so they're a granulocyte, and they're active in allergic and tissue injury because of allergies. So this is involved in allergy or allergic reactions. So neutrophils, basophils, and eosinophils are granulocytes, and they have granules, and they have a segmented nucleus. The monos are not granulocytes. They fight off bacterial infections and tissue damage. The neutrophils fight off bacteria. Eosinophils fight off allergies, fungal, and parasites. And basophils are involved in allergic reactions also. Okay, in phagocytosis, the first thing that happens is chemotaxis. And chemotaxis is when chemicals are produced that cause the white cells to come in. So chemicals are produced that make the granulocytes and the monocytes go to wherever the antigen is or the damage is. And then the white cell will eat the antigen. The particle is engulfed by amoeboid action, and it produces a vacuole. The vacuole just looks like a white space, and this is called a phagosome, and this is where it's eating something. Lysozymes, which is a chemical from the cell, will start to move to where the particle is and start to dissolve it. It will digest it, break it down. And then monocytes come in and clean up the products that are left behind. If there's any pieces of cells or whatever, it will take care of those. Okay, the body fluid secretion, these are also soluble mediators. These are things that are found in your fluids that help to prevent an antigen from making you sick. Body fluids, tears, saliva, sweat, and gastric secretions. These all have antibacterial, antiviral, anti-tumor, enzymes, and proteins that help to fight antigens off. The enzymes and proteins are lysozymes, prepurdin, complement, and different kinds of cytokines. A lysozyme is an enzyme that can break down and eat the bacterial cell wall. Prepurdin is a bactericidal and virucidal enzyme. It works with magnesium ions and complement to break down an antigen. Complement is a group of proteins that come in whenever antibodies attach to antigens to lyse the antigen. Cytokines are a group of chemicals that are produced by lymphocytes, monocytes, endothelial cells, which are lining cells in cavities, and fibroblasts in inflammation. And the four things listed there are types of cytokines. The lymphokine is produced by T lymphs. The monokines are produced by monocytes. Interferon is an antiviral, and this interferes with antiviral replication to prevent the virus from replicating. And interferon is in the body naturally, but they have also created a synthetic interferon that is given to patients who have HIV or other viruses to help slow down the viral replication so they don't get as sick. Interleukins are enzymes that initiate other immune responses that act on lymphocytes. Okay, acute phase reactants. These are different proteins that are found in the body, and they're either called acute phase reactants or acute phase plasma proteins. All of these are increased in injury, infection, and or inflammation. So they're very non-specific. These are all things that we can test the level of. We can test the level of CRP. We can test the fibrinogen level. And they're increased whenever there is injury, infection, and inflammation anywhere in the body. They're decreased in liver disease because proteins are made in the liver. And if the liver's not working right, these things are not able to be produced. CRP is C-reactive protein. It's one of the first things that rises in inflammation. And these are in order of concentration also in the body. Fibrinogen is a clotting factor. Haptoglobin binds free hemoglobin whenever a red cell is lysed. Alpha-1 trypsin neutralizes bacteria proteases, which are enzymes that the bacteria produces. C3 is a part of complement. It's one little portion of the complement proteins. Alpha-2 macroglobulin neutralizes proteases that are released from damaged cells. Ceruloplasmin binds copper and is active in collagen formation, and this is involved in Hodgkin's disease, which is a type of white cell disorder. And hepcidin, that's spelled wrong. It's supposed to be HEPICIDIN, hepcidin. This hinders iron absorption in the intestine, so this keeps iron from being absorbed, and we need it, of course, but the point is that anytime there's inflammation or infection or injury, all of these different types of proteins are increased in the body. Okay, specific, or your notes say acquired immunity. Immunity that is acquired is ones that you make up antibodies to. And there's two different types of acquired immunity, active and passive. Active immunity is when you are exposed to a virus or a bacteria, and your body makes its own antibodies to it. Or you get a vaccine and your body makes antibodies to it. So this is acquired and active. The active antibodies, you were exposed to the infection yourself and you made antibodies, or you got a vaccine and you made antibodies. Passive is when the antibodies are given to you. You don't make them yourself. So the main example of that is maternal antibodies. Whenever you're a baby, you get antibodies from your mother, and your mother's antibodies will help protect you from getting sick. Or there's antibodies that are given to you from some other source, like a bone marrow transplant, or you can also be injected with antibodies. The colostrum, that is the mother's first breast milk, and that's supposed to be highly concentrated with antibodies in them to help the baby from being sick. Okay, antigens. Antigens are also called immunogens or allergens, and they can be, like I said, anything that is foreign. It can be a chemical. It can be pollen. The most effective antigens, and what I mean by effective is capable of causing an immune response, are made up of protein. It doesn't have to be biologic like strep to make an immune response. And the example is pollen. It doesn't really have to be a bacteria or something that you know is going to make you sick. 95% of antigens that cause an immune response are foreign, um, and self-antigens, these are antigens that these are things that are found in your body. They may not be recognized as yourself at some point and produce autoimmunity. So sometimes your own antigens can produce antibodies. Okay. Definitions. Autologous antigen is a self-antigen. You don't usually have those. Heterologous antigens are an antigen that's similar to another antigen. It may make a partial response. An example for this is like different strains of a bacteria or different strains of the flu virus. Heterophile antigen is an antigen that is unrelated to plant or animal, but it will have a response. Your body will make an antibody to it. An antigenic determinant is the antibody binding site on the surface of an antigen. Every antigen has at least one binding site, and this spot is where antibodies attach, and it's called the epitope. A hapten is a very tiny antigen that will only make an immune response when it's carried by a larger protein, and it only usually has one epitope. Okay, factors affecting immunogenicity. So these are things that will affect whether the body makes an immune response to the antigen. The foreignness, how different it is from your body. The size, the larger it is, the more apt you are to make an immune response. The diversity of the epitopes, the chemical composition, the genetic composition. Usually the more complex the antigen is, the more likely you have an immune response. The route of invasion, the dosage, and the timing. If there is more of it, or it's exposed to you at a time when your immune system is weak, that depends. All of those things are dependent whether you make an immune response or not. Okay, HLA antigens, these are human leukocyte antigens. They're also called MHC antigens. MHC was the very first name, and it's called that refers to major histocompatibility complex, but most people just say HLAs. These are your own antigens that are on your cells in your body, and yes, they're still called antigens. We talked about these in hematology. They're on the cells, and they're your own antigens. They're also called MHCs. HLA antibodies are most often found in patients who have multiple transfusion. Now, this is antibodies, not antigens. You shouldn't have HLA antibodies, but people who do have a history of multiple transfusion or multi-parent women, which mean they've had a lot of babies. So the point is they've been exposed to a lot of different people's white cells, and they've made HLA antibodies. HLA antibodies are examples of detrimental actions of the immune system. HLA typing to see what kinds of HLA. They're not just HLA. There's HLA, and they have certain numbers and letters behind them. But they're used in typing for transplants, platelet transfusions, forensics, and paternity testing. Diseases associated with HLA antibodies, autoimmune diseases like lupus and rheumatoid arthritis. Transfusion reactions can be caused by patients who have HLA antibodies, and they react with whatever they're being transfused with. Graft versus host disease is, this is the accurate term when they say a transplant is not a match and your body, if the patient's body is rejecting it. If they say it's rejecting it, that means that they're having graft versus host disease. Graft is the transplant organ and host is the patient. And the patient fights off that graft because of the HLA antigens that the organ has. Okay, so transplanted tissues. Autograft is yourself. So this is like when a patient has a burn and they take a piece of skin from their buttocks and put it on their face. An allograft is the same species. Maybe you don't get it from yourself, but you get it from somebody else. A syngraft is something from an identical twin, and a xenograft is from a different species. So you know that they use pig heart valves to put in people in heart valve replacement. Pre-transplantation lab test. Before a patient is given an organ, there's HLA testing that is done to make sure that the HLAs match. This is called histocompatibility testing, and this helps to reduce the risk of graft versus host disease, reduces the risk for the patient to reject the organ. It increases the chance of a successful tissue transplant, and it reduces the amount of immunosuppressive therapy that the patient has to undergo. The T lymphs can produce an inflammatory response to the HLA antigens if there's graft versus host disease. And what happens is the patient will have anemia, decreased lymphs, increased CRP, that's one of those acute phase reactants, an increased SED rate, an increased total white cell count, and increased liver enzymes. You need to know those values. And I'm going to stop right there and split this unit up into two parts.